Hello everyone and welcome to the webinar Reversing Type 2 Diabetes, 3 Myths to Ignore, 2 Facts to Remember. We are ecstatic you have decided to join us, and we promise this information to be both insightful, practical, and well worth your time. Those of you who stay with us till the end of the webinar will also receive a free gift from us as a thank you for your attention. Today you're going to learn why drugs are not the best answer for type 2 diabetes, how your current treatment model is failing you, a new treatment model all type 2 diabetics should be pursuing as their primary strategy to fight diabetes, and how many are reversing diabetes altogether, ditching the worries about a lifelong of medication and quality of life crippling side effects. All this great information will be packed into today's webinar just for you. For those of you who are new to our webinars, I would like to take a moment to introduce who we are and a little bit about us, as we firmly believe in understanding where your information is coming from when it is health related especially. This webinar is a production of Twin Cities Metabolism, an integrative healthcare facility that has operated since 2007, specifically assisting type 2 diabetics to improve their disease with the ultimate goal of reversing diabetes and decreasing needs for medications entirely. At Twin Cities Metabolism, in everything we do, we believe in looking deeper and thinking differently. We look deeper by asking and answering frequently forgotten questions in conventional medicine today, including: what is causing your diabetes to begin with? Why did you develop it? And more importantly, can it be reversed without a lifetime of medications or struggle? Many years ago, we created a clinic in which we help patients answer these fundamental questions and help them develop strategies to decrease and eliminate their needs for medications, reach a healthy weight, and reverse diabetes altogether if at all possible. So the information you're about to hear has been gained through not only the latest medical studies, but also direct clinical experience with hundreds of diabetics just like you. Whenever we reference a medical study or human clinical trial, you'll notice an icon that will pop up in your screen. If you're interested in the details of the studies that we're referencing, you can click on that icon and the study will open up in another window for you to view. We are providing you with studies to show you that not only is the information we are going to reveal to you contrary to what you have heard, but also 100% true. I'm Jared Larson and I'll be your presenter today. I'm the founder and creator of Twin Cities Metabolism. My formal education is extensive and vast in the area of health and disease prevention. I have a bachelor's degree in exercise science and a master's degree in human nutrition. I am also a licensed nutritionist with the Minnesota State Board of Dietetics and a certified nutrition specialist. But what I really feel you should know is that I have spent many years and countless hours helping hundreds of type 2 diabetics reverse their condition with a system we have honed over years. It is this direct experience and the success stories coming from our facility that prompted us to conduct this webinar to set the record straight on what is holding you back from drastically improving your disease and showing you what is possible for anyone diagnosed with type 2 diabetes. But enough about us. This webinar is about you, the type 2 diabetic. So without further ado, let's go ahead and get started. In order to understand the importance of the disease that is type 2 diabetes, we must first take a minute and understand its true magnitude. We call this the diabetic reality. And unfortunately, many doctors and patients get lulled into a sense of false security that diabetes isn't that important. All they need to do is take their meds and everything will be fine. And really nothing could be further from the truth. And this common stigma or aloof attitude towards diabetes is more than dangerous, it's deadly. The facts are that type 2 diabetes is growing at epic proportions, creating a multitude of debilitating side effects, killing many Americans daily, and drastically decreasing both the quality and quantity of many lives. Based on statistics collected in 2010, there were over 25 million diabetics in America, making up 1 in 4 Americans over the age of 65 years old. The number of type 2 diabetics is going up rapidly every single day and expected to double from current levels by 2050. Yes, you heard that right, double. There is no doubt that our current treatment and prevention model for diabetes is failing at a very large level in all aspects. Not only is the disease growing at astounding levels, but it also is responsible for debilitating side effects that drastically shorten quality of life and length of life as well. Diabetes is the leading cause of kidney failure, non-traumatic lower limb amputations, and new cases of blindness among adults in the United States. Adults with diabetes have heart disease death rates about 2 to 4 times higher than adults without diabetes. To put this into perspective, diabetes increases your chance of dying from a heart attack by 2 to 4 times, not percent, times. In 2007, total costs of diagnosed diabetics medical expenses topped $174 billion. Diabetes is also the 7th leading cause of death in the United States, and the most important and shocking stat of all, decreases the average lifespan of an individual by 10 years, a full decade of life lost on average for each diabetic. It could be accurately stated that type 2 diabetes is a modern-day epidemic hiding in plain sight. So then the real question is, why is this happening? Why are the diabetes rates skyrocketing if current medical care is supposed to be so advanced? If current medical care was so good, even adequate, wouldn't all these problems be going away, not getting worse? The answer lies in the fact that the current treatment model for type 2 diabetes does not address nor attempt to reverse the cause of why someone developed diabetes to begin with. Said differently, its goal is not to reverse the condition at all. Every single diabetic is getting the same drugs, the same treatment, and we are all walking around blind to the fact that the treatment you are receiving is not intended to reverse the disease, even though the condition has been established as a disease that can be reversed in many people. Now that's a sobering reality for any diabetic. Instead of attempting to eliminate a disease that has been shown to be reversible, your current treatment favors a one-size-fits-all drug-based treatment that is given to every single diabetic with no intention of reversal. You see, the average diabetic in America today tells a version of the same story, and it goes something like this. You went to the doctor for a routine checkup, or maybe you weren't feeling quite right. The doctor runs some basic blood work, and I stress basic, and lo and behold comes back and says, "I'm sorry, but you have type 2 diabetes. Take this medication and follow up in a few weeks, and oh, by the way, you should lose weight. Eat less and exercise more. Out the door you go. Oh, and maybe see our dietitian at the clinic here or hospital. We'll see you in a couple of weeks." And that's about it. That is a standard of care model in America today for treating type 2 diabetes. No evaluation of why the patient may have developed type 2 diabetes to begin with. An overall plan on how you might be able to reverse it. And if the person does go to a conventional dietitian, many times they are given inaccurate and very, very poor advice. Ultimately, this standard treatment that every diabetic is receiving frequently leads to more and more medications needed to try and stabilize blood sugars, cholesterol, and blood pressure medications, as well as a disease starting to spread, and eventually insulin injections as your doctor's last resort when your body starts to resist the medications. The disease gets worse and worse over time with more and more medications needed. Worst of all, many diabetics suffer devastating complications that could be avoided, including neuropathy, amputations, blindness, heart attack and stroke, and an average 10-year decrease in their lifespan, as we mentioned earlier. On average, they die a decade earlier than they should. This is the horror story that is the average type 2 diabetic in America today. Many believe this is occurring because of a healthcare system that is focusing on drugs as their primary therapy and allowing big insurance companies to dictate and limit what healthcare options patients can and cannot have. This leaves a patient to repeat the same old cycle of drugs and side effects and an early death, all the while the pharmaceutical industry records record profits. The diabetic becomes a victim of the system. The only way to break this cycle is to step out of the box of allowing the pharmaceutical, insurance companies, and medical machine to limit you to a substandard of care. And that's why we're here today, to discuss the real facts about reversing type 2 diabetes and stopping the cycle for good. So let's step out of that box together and reveal the 3 myths to ignore and the 2 facts to know about reversing type 2 diabetes. And best of all, how all the information you learned today can be done in collaboration with your current medical doctor and drug treatment. No need to change doctors or create waves with your doctor. In fact, it integrates perfectly with what you are doing to help you decrease your needs for your medications and potentially reverse the disease together. Let's step out of the box and talk some straight facts about diabetes with this first myth. And myth 1 is this about reversing type 2 diabetes. Type 2 diabetes is a genetic disease of the pancreas. Many have been told this incorrectly by their doctors, and unfortunately the word genetic leaves many to put their hands up in the air and say, oh well, I just have bad genes, there's nothing I can do about it. First, let's dispel the first half of myth 1. We know that type 2 diabetes tends to run in families. However, we also know that just because your parents or grandparents had type 2 diabetes does not mean that you are for certain going to get it as well. Therefore, it is more accurate to state that your genes influence your chances of becoming diabetic, but do not determine the outcome. Does everyone remember the Human Genome Project in 2003? For those of you who don't remember, I don't blame you. I'll refresh your memory. In 2003, we were able to map the entire human genetic code. We essentially were able to decode the genes of a human being, and that's a pretty big deal. At the time, we thought this was going to help us pinpoint down what creates all diseases, including diabetes. But instead, after mapping the entire genetic code of human beings, we realized that it is not bad genes that ultimately determine if we get disease. It is actually what we do to our genes. Everything you do on a daily basis sends signals to your genes to either cause disease or create health. This is especially true of type 2 diabetes. If your mother and father had type 2 diabetes, and because they raised you and influenced your eating habits, your exercise, where you live, and some of the choices you made, and you followed in their footsteps and lived a similar life, then yes, your chances of getting diabetes will be much higher. Not necessarily from bad genes you inherited, but because of the lifestyle you lived. Ultimately, the wonderful accident that came out of the Human Genome Project was that we discovered our genes do not determine our fates, especially when it comes to chronic diseases like type 2 diabetes that develop over the course of time. For the diabetic, this means that just because your parents have diabetes does not mean you will get it. And more importantly, if you are a diabetic now, it does not mean that you cannot improve your disease drastically and potentially even reverse the disease altogether. Moving on to the second half of myth 1. Type 2 diabetes is a disease of the pancreas. In its truest sense, type 2 diabetes is a condition caused by something we call insulin resistance. The cause is not a disease of the pancreas. Type 1 diabetes is a disease of the pancreas, where your body no longer produces enough insulin. Do not confuse the two. They are not the same. The actual cause of most cases of type 2 diabetes is insulin resistance. It is not that your pancreas cannot produce insulin. It is that your body is no longer responding to the insulin your pancreas is making. In fact, many people who have type 2 diabetes actually have high insulin levels in the beginning of the disease. This happens because as your body begins to ignore insulin, your pancreas tries to produce more to make up for insulin resistance. So many diabetics actually have higher insulin levels. The example I use with my patients is a perfume bottle dropped in a room full of people. If we all locked ourselves into a 20 by 20 room and dropped a full bottle of perfume or cologne on the floor and broke it, at first the smell would be overwhelming. However, after a few minutes or even a few hours in that room, we all would get used to it and barely notice the smell after a while. This is because your nose and brain down-regulate your sense of smell. The smell is still in the room. Your body is just ignoring it. We see the same thing with clothes. Everyone on a daily basis wears clothes. And in our state of Minnesota, we wear more than the rest of you. Yet, you do not notice the fabric against your skin. In other words, you don't really feel your clothes hanging on you and rubbing against your skin from moment to moment. The sensation is ignored by your body so as not to overwhelm you. The same thing happens with type 2 diabetes and insulin. Type 2 diabetes develops because your body is ignoring the hormone insulin. And as a result, your blood sugar levels go high. Make sense? The one exception would be the long-standing type 2 diabetic that has had the disease for many years and is now on insulin. These patients can have what is called type 1.5 diabetes, where the pancreas is no longer working correctly because it is basically burned out over the course of time. These patients have lower levels of insulin because the pancreas is now malfunctioning. However, if this is you, if you've had the disease for many years and are now on insulin, there still is hope for you, as many of you still have enough pancreatic function left to improve your disease drastically, potentially even eliminate insulin altogether, as long as you act quickly. We'll talk about how in truth too. Let's move on to the second myth. Myth 2. Medication therapy helps you reverse type 2 diabetes. False. Medications help you manage the disease, not reverse it. And in fact, some medications actually cause the disease to accelerate and worsen by increasing the body's level of insulin artificially. Did you know that insulin is your body's major fat storage hormone and can create high blood pressure, high cholesterol, and increased risk for certain cancers? And injecting insulin or taking medications that increase your body's insulin levels will cause weight gain that can make diabetes much worse, creating a vicious cycle. Now, what sense does it make to rely on taking a drug that doesn't treat the cause of your diabetes, causes weight gain, can contribute to increased risk for heart attack, stroke, and cancer, and could make your condition worsen much faster? It doesn't, does it? For instance, when you go on a blood sugar medication, the treatment is never expected to result in you ever coming off the medication, because drugs don't work that way. They help you to prevent extremely high blood sugars, but they do not actually treat the cause of what created your insulin resistance to begin with. Therefore, you are actually going to be taking the drug for life. Kind of a catch-22 if you ask me. But many people are confused on this fact, believing incorrectly that medications actually treat the disease like antibiotics would help kill an infection. That simply isn't the case for blood sugar medication. To explain how, let's take a brief minute to show you how blood sugar is controlled in a normal person, what insulin resistance actually is, and how type 2 diabetes develops. I promise not to be overly technical, but only give you what you need to know so that you can understand the basics of why myth 2 is absolutely true. After hearing this information, please do not change or discontinue taking any medications given by your prescribing physician unless specifically instructed by the doctor who prescribed it to you directly. The following information is meant to enhance your understanding, not be misconstrued as direct medical advice. All right, with that out of the way, let's take a few minutes to describe how insulin works in a normal person so that we can help you understand how type 2 diabetes actually develops. In a non-diabetic, when they eat, food is digested and absorbed, eventually causing blood sugar to go up. When blood sugar goes up, your body tells your pancreas to make insulin. What insulin then does is it causes these little passageways on all of your cells that allow the sugar from your blood to go into your body. The end result is that your blood sugar drops back to normal levels. This is how blood sugar levels are controlled in a non-diabetic, someone who does not have diabetes. Type 2 diabetes develops because one or many metabolic disorders begin to develop and eventually trigger insulin resistance. Insulin resistance causes the little passageways on all of your cells not to open properly, and therefore the sugar in your blood cannot get into your body and starts to build up inside of your bloodstream. We see this as high blood sugar then. This is the beginning of type 2 diabetes, caused by what we call insulin resistance. The key to understanding why medications do not reverse type 2 diabetes and why myth 2 is absolutely true is that medications only help you manage blood sugars in the fact that medications are designed to increase insulin sensitivity, force the pancreas to produce more insulin, or artificially increase insulin by injecting it. But what they do not do is fix the cause of what is creating the insulin resistance to begin with permanently. Therefore, the cause of the insulin resistance, even when medicated, remains and is allowed to grow and worsen. As the causes of insulin resistance continue to grow over time, more and more medications are required to keep blood sugars down and stable. The medications are designed to be taken for life because they cannot permanently fix the causes of insulin resistance and therefore cannot be removed until you treat the actual cause of your diabetes. But medications don't and won't help you there. They help you manage high blood sugars. They do not help you reverse the disease. The causes of insulin resistance remain, and those that increase your body's insulin levels can actually make your diabetes worse and faster by causing weight gain. Myth 2 debunked. Medications do not help you reverse the disease, and some can accelerate it. Moving on to myth 3. The cause of insulin resistance and type 2 diabetes is the same in every diabetic. This is absolutely false. The causes of why someone developed diabetes is different from person to person, and there are many different causes that contribute to someone developing type 2 diabetes. You could have a room full of 10 people, all of which are current type 2 diabetics, and the reasons why they develop diabetes will be different from person to person. We can have young diabetics, skinny diabetics, male, female diabetics that are just as different on the outside as they are on the inside. Does it make any sense then to treat each person with the same drug and the same exact treatment? Of course it doesn't. To do so would be ignoring each person's unique biochemistry of why they are a diabetic to begin with. Yet this is what is done every single day in physicians' offices around the world. Again, there are many different causes of insulin resistance, and therefore many different causes of why someone would develop type 2 diabetes. For instance, did you know that environmental chemical exposure from today's industrial pollutants has been linked to type 2 diabetes? This was shown to be true and was published in the Journal of Diabetes Care in March of 2007. We also know that low magnesium levels have been associated with diabetes, as was shown in the Diabetic Medicine Journal in 2013. Or, another cause, what about the finding that high levels of cortisol will create high blood sugars? High cortisol levels can be created by many different causes, including high stress levels, insomnia, and many other factors related to physical and chemical stresses placed on the body. We also know that high levels of body inflammation is also associated and linked to high blood sugar levels as well. So we can see that diabetes is caused by a combination of many unique factors, not one single problem that's easily solved with a pill. Going even further, we also know that all the body's hormones interact together as a group and can contribute to abnormal blood sugar levels. For instance, we know that low estrogen and progesterone levels decrease the effectiveness of your body's own insulin and create weight gain. As a result, many women after menopause will begin to struggle with weight gain around their abdomen specifically. I'm sure many women can attest to that. And also will develop blood sugar problems as well around that same time. Or did you know that high estrogen levels can be harmful as well in both men and women because of their effect to slow down thyroid function? With drops in thyroid function, we see decreases in overall metabolism, leading to weight gain, which is a known cause of diabetes. As you can see, the contributing factors that we have listed so far are actually biochemical and hormonal problems that occur inside the body first and then lead to diabetes. It is not as simple as just losing weight like many will have you believe. There are very real chemical problems that lead to high blood sugars and contribute to diabetes, and they all interact with one another in a giant web that creates insulin resistance and diabetes. The list of potential causes of type 2 diabetes can go on and on. However, as an overall point, we like to stress the fact that type 2 diabetes is in fact a complex disorder of metabolism and is much more than just a disease solved by weight loss. Later on, we'll explain how getting the correct tests can help you reveal underlying causes of why you may have developed diabetes to begin with, including many of the causes we mentioned early. Again, correct testing can actually help you identify some biochemical problems that would have created the condition or at least exacerbated and began the condition to begin with. At this point in time in our webinars and seminars, we typically get the same questions and frustrations from our audience members, including, why hasn't my doctor mentioned or discussed any of this with me? Why hasn't my doctor run tests to look for underlying causes of why I might have developed diabetes to begin with? And why, if there's a proven better way to improve my disease, are they just giving me drug after drug? Well, the answer lies in reversing type 2 diabetes truth number one. And truth number one is this: your doctor wants and needs you to seek additional help for your diabetes outside of just taking your medications that they cannot provide you. The era of your doctor being able to provide for all your healthcare needs is over. Insurance companies, drug companies, limitations on time able to spend with patients, and even medical training killed that notion many years ago. Your doctor's primary role has changed to adjusting your medications and looking for major complications of diabetes. They do not have the time or the training to show you and teach you what is necessary to reverse type 2 diabetes, and you shouldn't expect them to. A medical doctor's primary job is to help you diagnose and treat major diseases with drugs and surgery. These are their tools. Unfortunately, as we showed you in myth 2, drugs and surgery are not how you reverse type 2 diabetes. With our patients, we have an analogy for this that helps them understand the role their doctor plays in their health care, and it goes something like this. If you need help fixing a problem with your teeth, you don't go to a cardiologist or heart doctor. Of course you wouldn't. You go to a dentist, as they are the ones with the training and expertise necessary to help you fix your teeth. The same analogy holds true for diabetics. If your goal is to reverse diabetes, which for every single diabetic listening, absolutely 100% should be your goal, you're going to need treatment options that go above and beyond medication. Going to your medical doctor and expecting them to deliver everything you need to help you try and reverse your diabetes is like going to a cardiologist to get your teeth fixed. And this is no secret to your doctor. Any doctor worth the diplomas on his wall knows this and wants you to seek out the additional help that you need to get better. Because deep down, all doctors want to see you get better, and most realize that they do not have the time nor expertise, and the diabetic also does not have the expertise to do it on their own either. Otherwise, they would have done it already. So truth one is simply that your doctor wants and needs you to do more than just take your medications, and needs it to be guided by those with expertise and experience in the area of lifestyle medicine. Because it is only through what we call lifestyle medicine that one can reverse type 2 diabetes. The notion that your doctor only wants you to take your meds and frowns upon anything else that would help you improve your condition is absurd, outdated, and quite frankly, needs to disappear. It is only with a cooperative effort from your medical doctor and a lifestyle medicine expert that you're going to be able to tame the monster that is diabetes safely and effectively. And with that, let's move on to truth 2, our last and most important truth. The entire reason we are here speaking to you now is to ensure you know truth 2, so that you can drastically reduce the negative health side effects of being a diabetic, potentially eliminate your needs for blood sugar medication, and undo the chains of a lifetime of worry about your health. Truth 2 is that in many cases, type 2 diabetes is a reversible condition. Diabetics have the ability to make diabetes a thing of their past, throw away the insulin needles, blood sugar medications, stabilize their blood sugars without drugs, and become a former diabetic. The magnitude and impact of this truth is astonishing when you stop and think about it. Diabetes is responsible for robbing Americans of years from their lives, frequently taking all the quality of life out of those last years from the severe health complications it brings to many. Anyone who has had a loved one with the disease understands this, and the disease either causes a slow deterioration of health, eventually leaving a broken down person whose body no longer allows them to enjoy the simple things in life, or it takes that person away in the blink of an eye without warning in the form of a stroke or heart attack. But all of this can be avoided, as most with diabetes can reverse the disease altogether. So why and how is this possible? The why is easy, because as you learned earlier, type 2 diabetes is primarily caused by insulin resistance, and the causes of insulin resistance can be corrected in most cases. Because the causes of insulin resistance are correctable is why you can reverse type 2 diabetes. And of course, this is logical. If you had pain in your foot caused by a thorn you stepped on days earlier, plucking out that thorn, or removing the cause of the pain as it were, would eliminate the pain altogether. And the same goes for diabetes. If you pluck out the causes of insulin resistance in your body, it will substantially diminish, and diabetes will simply go away, just like the pain caused by a thorn would. But how does one do that? How do you treat and remove the causes of insulin resistance? Is it a drug, a fad diet, a surgery? The answer is astoundingly clear. Clear as can be, actually. The only way you reverse diabetes is through lifestyle treatment programs designed specifically to help you identify, treat, and then remove the causes of insulin resistance. These lifestyle treatment programs are most commonly guided by healthcare professionals, include dietary changes, weight loss, exercise regimes, nutritional supplementation, and most importantly, are built for each individual. And no, we are not talking about just going on a diet and exercising more. Diabetes is much more complex than that, as you learned in Myth 3. One surefire way to failure is to try the latest fad diet. We are talking about lifestyle programs that address the individual causes of why you are a diabetic to begin with, are built around those causes, and help you treat those causes by developing a plan that is specific for you, the individual. There is no one diet or lifestyle program that will work for every diabetic, because each person is different, and the reason they develop diabetes is different. And therefore, of course, their path to becoming a former diabetic has to be different. Otherwise, they will likely fail. Diabetes does not have to be a death sentence, but don't take our word for it. What is the latest research saying? Overwhelmingly, the latest research is showing that indeed type 2 diabetes and the underlying causes of type 2 diabetes can be reversed, which by definition means the former diabetic no longer uses blood sugar medications and is able to keep their blood sugars under the diabetic threshold of 126. While there are many examples and recent research showing this, we believe the most important study was published in 2011. It showed that the foundational causes of type 2 diabetes could be reversed in as little as 8 weeks without the use of drugs, with lifestyle changes alone. This groundbreaking study showed for the first time that diabetes, once thought to be a chronic degenerative disease that stays with you for life, could indeed be reversed without the use of medications. The implications of this are enormous. Imagine what it would feel like to not have to worry about the side effects of diabetes, to not prick your fingers every day, or take insulin injections, or take so many pills or any pills at all. Well, the latest research shows that for many of you, this could be your reality. The only thing standing in your way is getting the right lifestyle treatment. You see, to reverse diabetes, you need to address all the causes of why you became a diabetic to begin with. Once you address those causes, you maximize your chances to become a former diabetic. That is the only way. And unfortunately, none of you out there are receiving this type of care, but you can get this type of care. It is available to you. You just need to know what professionals to seek out and where to look, as you will need expertise and guidance along that path. Now, for everyone on the webinar with us today, I would like to thank you all for your attendance, and I hope you learned a lot of great information about your diabetes and what is possible for you. But most of you will agree, information is not enough. In order to eliminate diabetes from your life and ditch the dependence on medications, you need action. No one ever turned their life around by simply listening to information. So for all of you out there looking to not become another diabetic statistic, but rather flourish and become a former diabetic, listen closely, as I have exactly what you have been looking for. And for those of you on our webinar only interested in hearing information, this is for you as well. Because action is all that produces results in the healthcare industry. You can learn and absorb lots of great information, but action is what is going to give you a new life. So I encourage all of you to take what I'm about to say to heart and take the first steps towards a diabetic-free future. And the message is simple. This exact treatment option is available to all of you, each and every single one of you. You do not have to continue down your current path. There are answers, and they lie in taking the next step and beginning a professionally guided, customized type 2 diabetes program that helps you address all the reasons you became a diabetic to begin with and guides you down the road to reversing them. And we should know, we have taken many down this exact road to becoming medication-free. In fact, we have been helping patients receive this exact treatment since 2007 with rave reviews from our diabetics. Our type 2 diabetes programs have one goal: to decrease and eliminate your dependence on medications and reverse the disease altogether if at all possible. We believe strongly that every patient that walks into our office has the potential to reverse their condition, and that it is our job to help them maximize their chances of doing so. No matter your location, your current medical provider, or the severity of your diabetes, we can help you. Let us help you like we have helped so many before you. For those of you interested in becoming a patient in our groundbreaking type 2 diabetes programs, simply take the next step and schedule a free consultation with us and myself directly. At your consultation, we'll help determine if you are a good candidate for our program and answer any and all questions you have regarding treatment, including what kind of tests we run to help determine the underlying causes of your diabetes, and how we structure your treatment to maximize your chances of decreasing medications, including what types of dietary changes you will need to make, what high-potency, highly specific nutritional supplementation you may need, and also other specifics, including our program costs and payment options. We have options that are affordable to most. Overall, your consultation is designed to make sure you are a great candidate and lay out all the specifics of the program before beginning without any obligation. For those of you who are serious about turning your diabetes around, we feel as though our programs provide you with the best tools, resources, and professional guidance to maximize your chances of reaching that goal. And best of all, we have designed all our programs to be 100% compatible with your current medical treatment and with your current medical doctor. No need to change doctors. We'll work with the doctor you have and build trust with. All you need to do is simply click the link to the right and request a free type 2 diabetes consultation. Our office staff will be in touch with you shortly to help you get your appointment set up and confirmed once your request has been sent. Go ahead and click that button right now to get started. And remember, the consultation is free, no obligation, and will help you determine if you are indeed a good fit for our program and will answer any and all questions you might have about the programs. And as promised, we also have that free gift ready for each and every one of you. Our gift to you is a reference chart of the known causes of insulin resistance and in turn type 2 diabetes for you to keep, all with links to the research studies that back up the information. Use it to learn more about why your condition is reversible, as well as a reference to support what you have learned today on our webinar. You can find and download that gift for free by clicking the link right now. And while you're over there, schedule your consultation and learn if you are a candidate to turn your life around. And to close tonight's webinar, we're going to open the floor up for a question and answer session. To ask a question, all you need to do is enter in your question below and hit send. We'll try to answer as many questions as we can live on the webinar. For those of you whose questions aren't answered, we will get back to you via email as soon as possible. For those of you going over to schedule a consultation now, don't worry, you will still be able to listen in to the question and answer session, as the schedule a consultation pop-up window will actually come up in a new window, and you'll still be able to listen in on all the questions and answers that we have geared up for tonight's session. To start off, we're going to answer some of the commonly asked questions, as well as some of the pre-submitted questions that we had prior to the webinar. But again, feel free, enter in your question below, and we will answer you as soon as possible. So let's go ahead and open up the floor and get started on the first question. I'm already on insulin. I've been a diabetic for many years. Will this program work for me? In other words, is it too late? I've been a diabetic many years. Is there any hope for me? And the answer is absolutely yes. One of the best examples we have from our patient base was actually a patient who was of the age of 86. She'd been a diabetic for many, many years, been on insulin, was on cholesterol, blood pressure medications, as well as another oral diabetic medication. Now, this patient, Lillian, was able to actually get rid of all of her insulin, decrease her cholesterol and blood pressure medications drastically, and this was done in a relatively short period of time. So the answer to the question is, will this program work for me? Is yes. Ultimately, is it too late? No, it's never too late. And the reason we know this is because we have direct observations from patients in our office. So the second question is one of my favorites, and it is, what does the program involve? How is it unique and different than my diabetic classes I may have attended at the hospital, a diet or exercise program I may have done in the past, or the latest supplement marketed online? And the short answer is that through unique metabolic testing, we help you identify what is triggering high blood sugars to begin with, biochemical reasons why your blood sugar would be high. Said another way, we help you identify what's creating the high blood sugars and the diabetes to begin with. And so this isn't done in conventional medicine. Most of the time it stops at ultimately your blood sugars are high, you're a diabetic, here's your medication. So what we're helping you identify and uncover is, first and foremost and most importantly, why are you a diabetic to begin with? Because ultimately no patients have had that looked at because it's not a standard of care model that anyone does. From that point, we've pulled the best of diet, nutrition, exercise, supplementation, lifestyle factors, hormones, metabolic function, and put it into a program that hits on all factors and is customized, overseen by a professional who's done this. Obviously, we have been doing this for a long time and helped many patients, so we have an incredible amount of clinical knowledge. And then it's also coordinated with your current medical doctor. So this isn't something that you would do replace your current medical treatment. It's actually meant to work right alongside of it. And as you're improving, the doctor is going to help you modify your medications and decrease them and do it in a safe way. Ultimately, we're giving you the best of all worlds, and that's why we are so different and so unique and why our success rate is where it is at. Next question is, what kind of results can I expect? While we cannot guarantee any results, and nothing we've spoken about early should be attributed as a guarantee or a result, many of our patients are able to decrease their needs for their blood sugar, blood pressure, cholesterol medications, lose weight, regain energy, and we have had patients complete what's considered an overall reversal of diabetes, meaning the patient began the program on medications with high blood sugars and finished off their medications for blood sugar control, whether it be insulin, metformin, or glyburide, and their blood sugar was then in turn under the diabetic diagnosis point of 126. So while results, of course, cannot be guaranteed, those are some of the typical results we do see with our successful cases. Next question is, some of the tests you are speaking of that look for underlying causes of diabetes and causes of high blood sugar. Does my doctor run those tests on me already? And would they if I asked them? And the short answer is no and no. And the reason your doctor doesn't run these tests, and typically will not if you ask them, is ultimately the tests we're speaking about do not end in a drug prescription. In other words, when you're looking for causes of why blood sugar would be elevated, causes of why someone is a diabetic and simply cannot control their blood sugar, you're going to look in the area of metabolism, hormones, and many other areas that physicians typically do not look at, because the end result is not a drug solution. Said a different way, the tests we're speaking about don't have drugs that would fix these problems. These problems are actually corrected through lifestyle factors. And so the analogy I have is, you wouldn't go into the woods to try to shoot a bear without a rifle. Okay, you just simply wouldn't even go in the woods if you didn't have a rifle, because you won't be able to do it. That would be silly. So in these cases, the analogy is analogous to, your doctor doesn't run these tests, and they typically will not, almost never in any case, will they run these tests, because there's no drug to treat it, and that's their primary source on how they're looking to help you. These tests are available, of course. As we spoke about earlier, they are a part of our actual treatment program, but they're just not typically run in a conventional doctor's office. Next question. How do I get off medication safely, and how is this all integrated? This is a great question because we've taken great lengths to ensure in our programs that all of our patients are safe, all of our patients are overseen by their primary doctor, and that it's done in an integrated manner. And so the way this is ultimately done is, as a patient enters one of our programs, they're ultimately going to have their blood sugars watched very tightly by us in our office. And then when we see signs that a patient is beginning to have lower blood sugar levels, this is a sign that their blood sugar control is improving. And ultimately, they will need to then in turn coordinate speaking to their doctor and having their doctor give them instruction on decreasing their dose when appropriate. So this is a very simple process that we've created. Ultimately, as the patient gets better, we're going to integrate and coordinate a visit with the primary medical doctor, where in turn they are going to decrease and or instruct the patient on any medication changes that need to happen. And this is done all the way throughout our program. It's actually a requirement of being a patient in our program that you have direct medical oversight. And it is very smooth, very, very easy, and foolproof. Next question is, what happens at the consultation? This is a great question. So at the consultation, what's going to happen is you're going to come right into our office, and we have some paperwork you fill out ahead of time, very brief. You're going to meet directly with me. We're going to go over your past medical history with a fine-tooth comb and hear your diabetic story. Ultimately, from this diabetic story, what we're going to help you determine is if you would be a good candidate for our treatment program. That's the first and primary, most important thing. We do not take in patients we do not believe we can help for some reason or another. And so that's the first and most important determination. From that point in time, if you are a good fit for our treatment program, we'll be going over all the nuts and bolts of everything, as well as any questions you have before you begin, which include what kind of tests we run, how we analyze them, where you're going to go to complete those tests. We're going to talk about how we analyze those tests, things we're looking for, and some of the common diabetic causes that we'll be finding from those tests. We'll talk about how everything is customized from that point, dietary changes you may have to make. We'll talk through some exercise changes we may have you make, although not necessary for all patients. And we'll go over any supplementation, although that is determined from your tests. And then ultimately, we will talk about timeframes, what you can expect from me, what we expect of our patients. We'll talk about results, and we'll also talk about insurance coverage, fees for the program, and how we can lay that out for you. As we mentioned before, we're going above and beyond the standard of care here. So we do have out-of-pocket expenses for our patients. However, the good news is we are set up to handle this, and we have payment options that are affordable to almost anyone. In the long run, we realize we are talking about diabetes, we are talking about your life, your health, and we have made payment options affordable to almost anyone so that you can get the care you need. Next question, is there any reason someone should not schedule a consultation? And the answer is yes. Our treatment programs were designed to try to attain diabetic reversal if at all possible. So they're comprehensive, they're thorough. Patients should want to be in our programs, should schedule a consultation if your goal is to reverse your diabetes, decrease your needs for your medications, lose weight, and really regain your health. If for some reason those are not your goals, if you're happy just taking medications, if you are looking for a quick fix, which doesn't exist, then this will not be a good fit for you. We always say it in the office, we take your health extremely seriously. You need to take your health seriously as well to be successful. So if for some reason you're not serious about getting better, or your goal is not to reverse your diabetes, then no, a consultation is not for you. You should not schedule a consultation. But for most of you, you're on this webinar, we realize that is your goal. That is what you're looking for. And so for all of you who are looking to attain those things, really remove the grasp that diabetes has on your life, do it in a professionally controlled environment that integrates with your medical doctor to ultimately get off medications and improve your life, then absolutely you should schedule a consultation and we'll see you in the office. And our last question we're going to be answering tonight, the rest of our questions will actually, if you submitted one that was not answered, will be sent to you as soon as possible in an email directly to your email address, and we'll have your answer there. So don't worry if we didn't get to your question. You'll definitely have that answered. It will just come in an email format. But our last question is, I do not live in the Minneapolis metro area. I am from a different state or a different location. Is that a problem? Can I still complete a program, and how would that work? And the answer is no, that is not a problem. Yes, you can complete a type 2 diabetes treatment program from afar. And we do that through coordinating through phone and email communication. We've had many patients from different locations, and not all of our patients are able to make it to our facility just because of location, and that is not an issue. You still can complete the entire treatment program, get all the oversight, get everything, all the benefit, all the details, all the success from afar. The consultation is simply begun over the phone, and then we will go from there in the correct format to get you and deliver you all the information you need. You still can enter this program. I encourage you to schedule a consultation. All right, everyone, thank you very much for being on. We always appreciate patients learning more and really getting more knowledge about their disease process. I encourage you to take the information that we gave you tonight and really apply it, because as we spoke about before, knowledge is great, but knowledge is not enough. In order to turn your life around, in order to reverse your condition and really improve and get everything you need, which is possible, you need to have action. So if you haven't already, go ahead, schedule your consultation. All you have to do is click the button off to the side. They are completely no obligation, and they are the best first step at reversing your condition and really improving your life. I want to thank you one more time for being on with us. I appreciate your attention, and have a great night.